So today, I want to talk a little bit about the maternal-fetal transmission of Lyme disease. This is an area that is still somewhat controversial, but it is a reality. In fact, a couple of years ago, the CDC finally admitted that this may be something that's possible. Now, I don't perfectly agree with their statement, but I'll read it to you here. What they say is, untreated Lyme disease during pregnancy can lead to infection of the placenta. Spread from mother to fetus is possible, but rare. Fortunately, with appropriate antibiotic treatment, there is no increased risk of adverse birth outcomes. So I would say that is kind of a mild statement in my personal opinion and personal experience in regard to, is this something that is common or not? So I'll just kind of explain to you why that is. First, I wanted to just talk about a study. This was actually a case report that was given back in 1985. So this was the actual first case report that we know of a mother who passed Lyme to her child. And this actually resulted in some abnormalities, and actually the child did not survive because of them, some heart defects that occurred during development. And during the pregnancy, this mother was not treated with antibiotics. She contracted Lyme during her pregnancy. And then after the mother gave birth, they did an autopsy on the child and did find those spirochete bacteria within that child. So it's one of those things where you can't 100% prove that this was the cause, but we can certainly see that spirochete was passed. And on top of that, there were complications that arose. And at the time that she contracted Lyme disease was right during that time when there was a lot of really important things going on with heart development. And so very, very possible that bacteria actually cause these abnormalities, these malformations, and in turn cause the death of the child. So this is the first report back in 1985. And then since then, for quite a long time, up until 2020, really it had kind of been ignored and almost denied that this was a possibility that children can receive Lyme disease through the placenta, through the maternal-fetal transmission. So it's great to know that we do finally have some backing from the CDC in some of those areas, a little bit. I mean, they say it's possible but rare. And let me talk about that a little bit, because that's an area that I am not quite sure on either. There was another study too that I just wanted to bring your attention to, and this was actually an animal study where they purposely, now if you're a dog lover, I'm sorry, but this is what they use. They use dogs, and they infected these female dogs with Lyme disease and watched to see if that spirochete would then pass to their puppies, and in many cases it did. So there was, again, another case where we can definitely see in an animal study that it was passed from mom to child. So I think there's enough evidence out there to say that this is a reality. But let me just share with you some of my personal experience. So this is part of the reason why I got into treating Lyme disease is, first of all, my wife developed and contracted Lyme disease. We don't know exactly when. We think it was probably during her high school years, because she had always had some odd symptoms, aches and pains, fatigue, other things like that growing up that just didn't quite make sense with a growing teenager. Shortly after my wife and I married, she got pretty sick, and it took us several years to figure out that this was Lyme disease doing it to her. Now, fast forward some years here, and now we have 3 children, and our first child, one of the things that we noticed as she was growing up is that she as well had some odd aches and pains for a young girl. And on top of that, another thing that we really noticed with her was that she, whenever we had the stomach flu come through our house, normally you get the stomach flu, you throw up a couple of times, it sucks, but you get over it and it goes away within a day or two. She would have literally every 10 minutes she would be vomiting, and this would last for hours. And it just was one of those awful things. As a parent, you're just like, what's going on with this kid? Why is this happening to her? And everyone else gets over it after a couple times here. So there were a couple of red flags that hit us that told us that something was going on. And this was going on as she was, age 5, 6, 7. But it really seemed to be around the age of 8, 9, 10. And to be honest, again, I have 3 kids, and all 3 of them actually have Lyme disease. And it was around that age for all 3 of them, around 8, 9, or 10, where things really changed. And it was more of a mental health, psychological symptomatology that we saw with them. Our first daughter really developed some strong OCD type symptoms, and had some tics and other things. And so that was one of the things that really set us off for her. Our second kind of really developed that really strong, what we call if you've heard of PANS or PANDAS, and we could go on another video about that, and there's plenty of good videos out there about it, but PANDAS is pediatric autoimmune neuropsychiatric syndrome, neuropsychiatric disease associated with strep. And so if someone gets strep throat and then they develop these psychiatric symptoms as part of that. PANS is more general and broad, where it's pediatric autoimmune neuropsychiatric syndrome. So we know that it's not just strep throat that can cause this, it's a number of other things. In our case, it was Lyme. Our son, who was the sweetest and is the sweetest kid, just overnight changed. One day, all of a sudden, he just flew off the handle and developed terrible anxiety and panic and aversions and just things that just were really tough to deal with. We didn't know what was going on. It took us a while to figure out that this could be Lyme disease with him. And he tested positive. Our youngest definitely fit the more of the OCD, anxiety type of symptoms too, but again, around that age of 8 or 9 or so. And what's really interesting is that I've seen that a lot with other kids that have come into the practice. It seems to be somewhere between the ages of 6 and 10 that we see some of these psychiatric symptoms coming out in kids, especially when the mom has Lyme. And there's reason to believe that maternal-fetal transmission occurred in these cases. With my kids, they grew up in the city. I guess it's a small suburb. It wasn't a big city or anything like that, but we didn't have ticks in our backyard. We didn't have the exposure that my wife had growing up. Now, granted, they could have got a deer tick and we just didn't notice. I mean, that's definitely happens a lot because those ticks are so darn small that many times they're not even seen. But in each case, it followed a very specific pattern, and there was a lot of similarities as far as when it occurred and what we saw. And also, all 3 of them tested very clearly positive for Lyme. So I would have to disagree with the CDC that this is rare. I think it's more common than we know. I think that Lyme disease is a lot more common than we know, mainly because Lyme mimics so many other things. And again, going back to what I said earlier, we don't always see a deer tick bite. It's not always the presenting symptoms, not the first thing we always notice, because they can bite in an area we don't see them. They're very, very small. We may never notice them. We don't feel their bite, and they can fall off having already transmitted and done all that they're going to do. And then we develop these chronic symptoms that don't really make any sense. So maternal-fetal transmission of Lyme is very real, and the good news is that it's treatable too, and I think that's really important to know. And there's a lot of tools. There's the classic treatments for Lyme, which do work in these cases. There are ways to treat that inflammation that occurs in the brain that causes the psychiatric symptoms, and it can get better. So again, today I just wanted to make sure that that's something that's brought to our awareness, that we're thinking about that. If you are a mom and you have Lyme disease yourself, or suspect that you do, and are seeing some of these symptoms in your kids, it may be that they developed Lyme disease as a maternal-fetal transmission, and there's ways to help them. So, and you should never feel, the other thing I would say too is there are some times where I will share this with a mom, and I really want to make clear that you should never ever feel that you did this to your kid. First of all, you didn't know, number one. Secondly, mean, would you change your mind? Would you not have kids if you knew that that was a possibility? I mean, I know we wouldn't. We would still have kids. We may have changed what we were doing. We may have been more diligent about treating my wife while she was pregnant, and that is key as well, by the way, is that we treat Lyme during pregnancy if a mom is pregnant and has Lyme. But it's not your fault. It's something that happens. It's something that we deal with and we figure it out. So I hope this was helpful for you today, and I hope you learned something. And please feel free to share this. And also, just if you're still watching, thank you. And if you're watching this before March 30th, just check my calendar here, of 2023, the next week, a week from today, then today's the 23rd, we will be doing a Q&A here on YouTube and also live on Facebook as well. So if you're following us on either one of those platforms, please feel free to tune in, and please feel free to ask any questions. If you're not going to be there, just throw some questions in the comments here, and I'd be happy to do my best to answer those. I'm going to be live as long as we need to answer some of your questions that you have about Lyme disease.